So looking at lymphocytes, the normal range of lymphocytes, which is a part of it's a white blood cell, range is 25 to 40%. They're elevated. We look at acute viral infections. Lymphocytes deal with viruses primarily. Chronic infections like tuberculosis. Tuberculosis is due to bacteria. So you'll notice that they are types of cells that work with other things, not just viruses. If they're elevated and you don't know a reason, you can't figure out any kind of virus or bacteria, then we're talking leukemia now. Now, it could be non-immunoglobulin E mediated food allergies. In other words, again, we're talking about the white blood cells of the immune system going after foods that we're become sensitive to. So an IgG test should be done, immunoglobulin G should be done. Bone marrow suppression rather can cause this. As it says, there's lots of reasons. Chemo, radiation can reduce it because it's chemo and radiation, right? Chemo is like it's like a poison, honestly. Radiation, we know what radiation does. Either one of these things can suppress white blood cells because it's literally destroying them. That's part of the treatment. Again, B vitamins, it could be B vitamins because B vitamins are critical to the formation of cells and the maintenance of those cells. Really important. And white blood cells and lymphocytes are included in those cells that are maintained by these different types of B complexes. Sometimes it's high normally in infants because they're just born, the cord, there could be infections as a result of birth, and everything is new to the baby. Bacteria from the mom, bacteria from the birth canal, bacteria from the staph. These can happen in infants. Young children it happens a lot in them too because why? Infections, right? They get colds a lot, they get different exposures because it's all new to them. So these can be normally high. Now, if they're low, possible bacterial infection, because we're just literally using them up. It could be an immune deficiency syndrome. That could be serious. That has to be checked. It has to be taken care of by your physician. So please don't let that go. It could be something like HIV. Now, we do think of certain things that we can use naturally, like lipoic acid. It helps those different things, helps this condition of low lymphocytes sometimes, not always. Did you notice the list here? Lipoic acid helps inhibit reverse transcriptase, which can help with that condition. Bovine colostrum. Now, what if you're allergic to it? It can make it worse. Think about that. Selenium has been known to help. Vitamin E, zinc, glutamine, vitamin C have all been known to help at different levels and different dosages. You can't really just know this yourself. You need to know why these cells are the way they are and why are they low. And that's where you have to have your doctor, because doctors are trained to know the difference between just a low cell count and then looking at all the other factors together to see why this is a low blood cell count. What's going on? Okay. Vitamins can do it, medicines can do it, and there's a whole interactive relationship here that you need your physician to ascertain as to why these things are low.